Today on April 7th, World Health Day, the Banega Swasth India campaign's goal of Lakshya Sampurna Swastika will not be fulfilled in any measure if we don't focus specifically on the health and nutrition of our mothers and our children. My colleague Megha Prasad spoke with the Union Minister for Women and Child Development, Smriti Irani. Take a look.
I want to begin by asking you about the maternal mortality rate and the infant mortality rate. Now, the infant mortality rate in the last 8 years, drastic change from 37 per thousand in 2015 to 30 per thousand now, the current figures. But how do we ensure, while we have made a lot of improvement there, how do we ensure better facilities for women and children?
I think we have to recognize that there is a cyclic impact on a child's health which generates for how healthy a woman is, the mother giving birth. It also has a contribution of the father's health and the genetic predisposition a child has towards a healthy future. That recognition needs to happen. And that is why what is the cyclic impact the government is unleashing? First, let's begin with sanitation. Not many people know that good health is dependent on access to good sanitation facilities. Washing of hands, you need access to clean water. So if you look at the Jal Jeevan mission and the Prime Minister's agenda of ensuring every home has tapped water, that is an initiative that is equally based in health as much as it is based in access to clean drinking water. The second issue is access to clean toilets. Prime Minister has built 110 million individual household toilets in the past 8 to 9 years. And when you have an open defecation policy literally supported by an administration which does not look at this very basic need of the citizen, which happened in the UPA era, that is when you perpetuate or propagate illnesses and sickness within a family confine. And that is why the second intervention, which is the building of the toilets, is equally important for a healthy living circumstance for a woman, child or the family at large. The third is access to nutrition. In the past 2.5 years, the Prime Minister has ensured that 800 million Indians get access to free food, free ration, for which money is spent by the Government of India alone. It's from the National Treasury. And the doorstep delivery of the same is also accompanied by additional nutrition support for pregnant, lactating women and children under the age of 6. I think that additional nutrition support is also intended to ensure that the day-to-day struggle of ensuring that all mouths are fed is a struggle in which the government can be of support to our citizens. Fourthly is the access to affordable medication. Now we have over 9,000 plus Jan Aushadhi Kendras in the country, which in fact have 40 products particularly highlighted only for women. Menstrual health included and hygiene included. One of them is the 1 rupee sanitary pad that the Honorable Prime Minister spoke about. So I think that on these 4 levels, nutrition, clean water, sanitation facilities, access to affordable medicine, the government has done much. Infrastructurally, the government has also ensured that over 1 lakh plus wellness centers open up in the country. Infrastructurally, now every district in our country will have a medical college. Infrastructurally, the number of AIMS have literally gone up. But apart from that, the infrastructural support needed for district hospitals, PHC, CSCs, is also something that the government has afforded much fiscal support to. So I think that we can't be myopic enough to look at MMR or, for that matter, children's or infants' mortality from only that one perspective. For instance, we run in the Ministry of Women and Child Department the Poshan Abhiyan, which is the Prime Minister's flagship scheme for nutrition for pregnant, lactating women and children under the age of 6. We don't run it alone. It's an amalgam of 18 ministries, which includes Sports Ministry, which includes Rural Development Ministry, which includes Urban Development Ministry, which includes Jal Shakti, which includes even agriculture. So it's not an effort of one department alone. It's a combined governmental initiative which we ensure percolates on the ground with the support, because ultimately the basic infrastructure lies with the state governments.
और आप उस तरफ कदम ले रही हैं, आप और आपकी सरकार. Thank you for your time.
Thank you.
Thank you.